or breathing portion of a patient's lifeline, specifically with a patient that is choking. A choking patient needs immediate help to restore breathing. In adults, the most common cause of choking is food. Let's learn how to help a conscious and unconscious patient expel an object that's choking him. If you believe a person is choking, begin with scene assessment. Stop, think, and act. Since you're not likely to have contact with body fluids and time is important, you usually do not need personal protective barriers. Ask a responsive patient,
"Are you choking?"
If he can speak or cough, encourage the patient to cough until he expels the object. If the patient cannot speak or breathe, give the emergency responder statement and alert EMS. After the patient indicates he wants your help, you will either use back blows, abdominal thrusts, or chest thrusts to attempt to dislodge the object. To deliver back blows, take a position to the side and slightly behind the patient. Supporting the chest with one hand, lean the patient forward. Next, firmly strike the person between the shoulder blades with the heel of the other hand 5 times. Stop if the obstruction clears. If 5 back blows fail to relieve the airway obstruction, give up to 5 abdominal thrusts.
Are you choking?
Abdominal thrusts use residual air in the patient's lungs to blow the obstruction clear. Stand behind the patient with your arms around her waist. Find the patient's navel with one hand. Make the other into a fist and place the thumb side against the patient's abdomen slightly above her navel, like this. Put your other hand on top of your fist. Bowing your arms so you don't squeeze the patient's ribs, pull your hands inward and upward in a thrusting motion. If the obstruction is still not relieved, continue alternating 5 back blows with 5 abdominal thrusts. Abdominal thrusts may not be possible with some individuals, such as those who are pregnant or markedly obese. In these cases, provide thrusts in the center of the chest. Use your fist with the thumb inward and the other hand on top, just as you do with abdominal thrusts, but put your fist on the same site where you would perform a CPR compression. When you practice these techniques, be sure to simulate thrusting. Never perform thrusts on a person who does not have an obstructed airway. If the patient becomes unconscious, support her carefully to the ground, immediately activate the emergency services, and then begin CPR. Following the chest compressions, you should quickly look inside the patient's mouth to see if there is any solid material visible in the airway. If an object is seen, you should remove the object with your finger. If no object is seen or the object has been removed, you should proceed with 2 rescue breaths.
What happened?
Greg cut himself on the saw. Can you call for help and wait outside for them till they get here and bring him back?
Okay.
Thanks.
Can I help with anything?
Yeah, could you get the first aid kit, please? Yeah. Thank you. Okay, Greg, try and elevate from here. Okay, try and keep your arm elevated here. Okay, great, thanks. Great. Keep moving, Mary. Thanks. Okay, Greg. Put this on here. Okay. Hang in there, Greg. Okay, let's have a look at this.
The S of the Lifeline's ABCDs prompts you that after confirming the airway, breathing, circulation, and defibrillation if needed, you need to control serious bleeding. Serious bleeding can be life-threatening because blood carries oxygen to the body tissues. The body holds about 6 liters or quarts of blood. Losing even one can cause death. There are 3 types of bleeding depending on the type of blood vessel injured. Arteries are the largest vessels and carry blood from the heart to the tissues. Arterial blood spurts with each heartbeat and is bright red. Arterial bleeding is the most serious because the patient can lose a lot of blood quickly. Call the emergency medical service immediately for this type of bleeding. Veins lead from the tissues back to the heart. Venous blood is dark and flows steadily without spurts. Venous bleeding can also be life-threatening. If you cannot control it, contact the emergency medical service and monitor the patient's lifeline. Capillaries are tiny blood vessels between the arteries and veins where the blood and tissues exchange oxygen. Capillary bleeding tends to be slow and easily controlled unless the injury covers a large area. Monitor the patient's lifeline and contact the emergency medical service if necessary. Tell the patient that you're an emergency responder and ask if you can help. When the patient says yes, call emergency medical services.
Go call for help.
Since the patient is responsive, you have confirmed the patient has an airway, breathing, and circulation. Serious bleeding is usually obvious. Next, control the bleeding by using direct pressure. Put a clean cloth or dressing on the wound and apply pressure. If you have no dressing, use a piece of cloth or even just your gloved hand if there's nothing available. Maintain the pressure continuously, but you may periodically release pressure to see if the bleeding has slowed or stopped. In addition to direct pressure, you may also use a pressure bandage. While maintaining direct pressure, tie another dressing over the initial one. The patient may assist if able. If the dressing becomes blood-soaked, don't remove it. Instead, add another on top and continue direct pressure. Do not remove blood-soaked dressings. Although there may be regional variations, your instructor will advise you of these. Blood will clot in the dressing and slow or stop bleeding. Removing the bandages will disrupt this process. Shock is the body's response to serious injury or illness. It can be life-threatening and happens when not enough oxygenated blood reaches the body tissues. There may be too little blood because of serious bleeding, or it can happen when the body no longer regulates blood flow to the tissues. In shock, the tissues don't get enough oxygen. 9 signs and symptoms indicate shock, though some may occur with other injuries. They are mental confusion, anxiety, restlessness or irritability, altered consciousness, pale or bluish tissue, rapid, weak pulse, shallow but rapid labored breathing, nausea, vomiting. First, lackluster eyes, dazed look, and moist, clammy skin, sometimes with shivering. By the time you get to shock management, you will have progressed well along the patient's lifeline. You will have assessed the scene and applied your barriers. Through primary assessment, you would have alerted emergency medical service and confirmed airway, breathing, and circulation. There would be no need for defibrillation, or you would be providing CPR, and you would have handled serious bleeding. To treat shock, if the patient is responsive and you don't suspect head, back, or neck injury, put the patient in a comfortable position. If there may be head, back, or neck injury, don't move the patient and keep his head and neck immobile. In either case, cover or shade the patient to maintain his normal body temperature. If you've had to control serious bleeding, maintain control of the bleeding. If there's no reason to suspect head, back, or neck injury, elevate the patient's legs 15 to 30 centimeters, 6 to 12 inches. This shifts blood to the more critical chest and head areas. If oxygen is available, it can help a patient in shock. Some units are easy to use and require little, if any, training. Your emergency first response instructor may teach you how to properly use oxygen as part of your training. Spinal cord injuries can cause permanent paralysis or death. The spinal cord runs through the neck down the back and connects the brain to the rest of the body's nervous system. A break in the spinal cord makes it difficult for the brain to control the nervous system below the break. Injuries to the head, neck, or spine may injure or threaten the spinal cord. Moving a patient with a head, neck, or spine injury may make the injuries worse. Therefore, never move a patient with a suspected spinal injury unless absolutely necessary because of imminent danger. Conduct your primary assessment where you find the patient. You would only move the patient to avoid immediate further harm, such as if the patient were in the water or a burning car or building. You would also move the patient, if necessary, to provide CPR. You should suspect spinal injury with situations that cause injury to the head, neck, or spine. These include auto accidents, being thrown from a moving object, falling, especially from a height higher than the victim, a penetration wound, such as a gunshot, any severe blow to the head, neck, or back, an accident that includes hitting something head first, such as diving into shallow water, lightning strike, or any severe impact injury regardless of what part of the body was struck. 8 indications that a patient may have a spinal injury are change of consciousness, difficulty breathing, vision problems, inability to move some or all of the body, paralysis, headache, vomiting, loss of balance, tingling or numbness in the extremities.
Hello?
Following the ABCDs of the lifeline, start with scene assessment. Conduct your primary assessment with the patient in the position you find her, unless the patient's safety is in question or her lifeline is in jeopardy, meaning you need to open the airway, deliver CPR, or control serious bleeding.
May I help you?
Put on your barriers and contact emergency medical services.
Call for help.
The patient must be on her back for CPR. If she's not already on her back, you'll have to turn her while minimizing risk to her spinal cord. You want to stabilize the head and neck so that as you turn the patient, they stay aligned and unmoved relative to the spinal column. If you have someone who can help, have him hold and stabilize the head as you roll the patient all at once, keeping the head, neck, and spine together as a unit. If you're alone, you'll stabilize the head yourself. The log roll technique helps you do this. Tuck the arm away from you under her hip, and while supporting her head, roll the patient toward you. Gently ease the patient onto her back and continue with the ABCDs by opening the airway, rechecking for breathing and circulation, and then starting CPR as necessary. During your primary care course, your instructor may also have you practice one or both of the 2 recommended primary care skills: automated external defibrillator use and emergency oxygen use. Depending on local guidelines, restrictions, or laws, your emergency first response instructor may or may not be able to offer a skill development session on these recommended primary care skills. Now that you understand the 8 primary care skills, let's apply them to some realistic situations. Watch as the emergency responder in each scenario adapts the lifeline ABCDs to the realities of the situation.
Grandma, are you okay? What happened? What's wrong? What happened? Hang on, everything's gonna be okay.
Stop, think, and then act. Is there a hazard here? The emergency responder sniffs for gas and confirms the gas stove is turned off.
Grandma, do you need help? It's okay, I'm an emergency responder. May I help you? Jimmy, come here quick. It's okay.
What's wrong?
I don't know. Something's wrong with Grandma. Go call for help. Tell them we have an emergency and then come back and tell me what they say.
I'll call and come back.
The emergency responder gives the medical statement and gets emergency care on the way. The emergency responder monitors the patient's lifeline. She's breathing, confirming airway, breathing, and circulation. There's no evidence of bleeding.
Help will be here soon.
Help me put her in the recovery position. Put her leg a little bit forward. Go get the pillow and blanket on the couch. Go wait for the ambulance outside.
The emergency responder treats for shock and continues to monitor the patient's lifeline until help arrives.
Okay. Help is on the way. Don't worry.
The emergency responder stops, assesses the scene, thinks, and then acts.
Ken. Ken, are you all right? Ken. Front desk, this is Jocelyn. I'm in the library and there's something wrong with Ken. Call emergency medical services immediately. No, I'll manage. You wait for the paramedics and then bring them back here to us. Hurry. Ken? Ken, are you okay? Ken, it's Jocelyn. I'm an emergency responder. May I help you? Ken? Ken, are you all right?
The emergency responder finds the patient non-responsive and turns him so she can begin CPR by opening the airway and checking for breathing. The emergency responder provides rescue breaths and chest compressions until emergency medical personnel arrive.
One and two and three and four and five and six and seven and 8 and 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One and two and three and four and five and six and seven and 8 and 9, 10, 11, 12.
The emergency responder stops, assesses the scene, thinks, and then acts.
Ken. Ken, are you all right? Ken. 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 Ken, are you okay? Ken, it's Jocelyn. I'm an emergency responder. May I help you? Ken, are you okay? Ken.
The emergency responder finds the patient non-responsive and turns him so she can begin CPR by opening the airway and checking for breathing.
Front desk, this is Jocelyn. I'm in the library and there's something wrong with Ken. Call emergency medical services immediately. No, I'm okay. Just wait for the paramedics and bring them back here to us, and hurry.
Christopher, the operator, please. Carry Christopher, call the operator.
The emergency responder provides rescue breaths and chest compressions until emergency medical
1
personnel
and 2
arrive.
And 3 and 4 and 5 and 6 and 7 and 8 and 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9, 10, 11, 12.
A medical emergency with more than one victim and only one emergency responder requires some thought. You can only do so much, so do the best you can. Stop, think, and then act.
Yeah, I need to report an auto accident on the corner of Alton and Pacific. It looks like you might have a couple injured passengers. Yeah. Yeah, okay. Sit tight, all right? Help's on the way.
The emergency responder approaches the scene cautiously, keeping himself safe and watching for hazards as he approaches the scene.
Hey, my name's Matt. I'm an emergency responder. May I help you?
Yes,
Well, where do you hurt?
on my head. I'm okay.
Okay, I want you to try not to move it, okay? Let's wait till the medical crew gets here so they can check you out. All right? It looks like your passenger may need some help, so I'm gonna go take a look at her. So just sit tight and relax, all right? I'll be nearby. Hey, how you doing? You okay? You all right? Just relax, okay?
The emergency responder follows the second patient's lifeline and controls serious bleeding. Notice that he continues to monitor the ABC parts of the lifeline while maintaining pressure on the wound.
How's your head feel?
The same.
Okay, just relax. Help's on its way.
The emergency responder asks the question as a simple way of checking the first patient's lifeline.
Is there anything that I can do?
Are you a trained emergency responder?
No.
That's okay. You know what? You can put on this extra pair of gloves I have here.
Okay.
Try and lay still, okay? Keep your head still for me. What I need you to do is I need you to put pressure on this wound here, okay? If you need another bandage, go ahead and take one out of that box and put it right on top of this, all right? Keep pressure on the wound the whole time. Okay, so when I take my hands off, go ahead and replace them with yours, okay? Here we go. Good.
The emergency responder continues to monitor the ABCDs for both patients until the emergency medical service providers arrive.
There you go, lay still. Okay, keep pressure on there.
Okay.
Okay, try and relax, okay? I'm gonna hold your head until the ambulance gets here.
All right.
Sit tight, all right? The guys are here.
How many people do we have in the vehicle? One?
Just two.
Two, that's it? Anyone ejected? Anyone else in the vehicle? No?
Came on these guys.
No, that's it. Okay, what do you have right there?
As you saw, having more than one person at the scene increases the aid available. By encouraging your family and friends to complete the emergency first response courses, you increase the chances there will be more than one emergency responder at hand in a medical emergency. As an emergency responder, you play a crucial role in a medical emergency. In life-threatening emergencies, you provide the critical first links in the chain of survival that summons emergency medical aid and monitors the patient's lifeline, providing aid that increases the chances of survival or revival. In emergencies that are not immediately life-threatening, you provide comfort and reduce the risk of permanent disability. Most emergency responders will never need their skill, but practicing them and reviewing this program will help you be ready to reach out and help another in need should you ever need to. Now that you've completed Emergency First Response Primary Care, you're ready to complete the Secondary Care course.
I got dizzy about a half an hour ago.
As you recall, this is Secondary Care because it follows the primary care of assuring the ABCDs of the patient's lifeline. And, as you recall, primary care never stops. You constantly monitor the patient's lifeline. However, if emergency medical services are either delayed or unavailable, you'll need the following secondary care skills. You'll practice 4 secondary skills: injury assessment, illness assessment, bandaging, and splinting for dislocations and fractures.
No. What about back here?
Injury assessment helps you identify injuries that affect the patient. You can attend to some of the injuries and you will report them to emergency medical personnel once they arrive. Remember that you always begin with primary care and the ABCDs. Assess the scene. Stop, think, and then act. Apply your barriers by putting on your gloves. Check for patient responsiveness, then give your responder statement. Contact the local emergency medical service if at any time you begin providing primary care.
My name is Eileen. I'm an emergency responder. May I help you? Okay, let's call for some help. You fell off your bike? Yeah.
Remember that you always begin with primary care and the ABCDs. Assess the scene. Stop, think, and then act. Apply your barriers by putting on your gloves. Check for patient responsiveness, then give your responder statement.
My name is Eileen. I'm an emergency responder. May I help you?
Contact the local emergency medical service if at any time you begin providing primary care and have found the patient is not breathing. Be sure that you don't need to attend to anything on the patient's lifeline before beginning the secondary injury assessment. Start by telling the patient that you're going to check for injuries. Hold the patient's head and ask the patient to keep her head still and answer questions verbally rather than nodding or shaking her head. It helps to ask questions that she can't answer with a yes or no. You start your assessment at the head and work to the patient's toes. If the patient complains of head, neck, or back pain, stop the assessment immediately and keep the patient immobile until help arrives. Feel for deformities on the patient's face with a gentle touch.